Diet science, food science. Nutrition is a very important pillar. What is this food science? For example, the Lauki Kalp bottle gourd regimen. For some, we give special body cleansing regimens. Those with different autoimmune diseases are often given a milk-based kalp. People with colitis should follow a buttermilk kalp. Those with chronic cold and phlegm can follow a date and grape kalp. Those with kidney and skin problems should take mostly raw food. Sprouts, salads, fruits, and at most lightly boiled food. Stock chilies, heavy spices, and fried foods for some days. This helps many kidney and skin conditions. If Vata disorders are strong, there are many types of fasting. Water fasting, fruit fasting, juice fasting, soup fasting, and fasting with only one special grain. For arthritis, I suggest 80 vegetables and rotis of Ragi and Bajra. For diabetes, multigrain flour rotis. Avoid regular wheat and white rice for some time. Use special anti-diabetic flour and combine with fasting. This is also a kind of grain-based fasting called kalp. So those with Vata problems or diabetes especially need these types of fasting. If someone has lumps or cysts in the body, they should follow a zero oil diet. Stop ghee, oil, refined flour, salt, and sugar for 1 to 2 months. If you keep eating ghee and oil, fat cells will keep depositing. People often do things halfway. A little yoga, a little kapalbhati, but not regularly. Consistency is very important. Without regular yoga, lumps will not clear. Without regular yoga, cancer will not improve. Without regular yoga, type 1 diabetes will not improve. True transformation depends on continuity. In 1 to 2 months, PCOD, uterine cysts, polycystic ovaries, brain tumors, breast tumors, and lumps in arms or legs, all these polycystic issues, kidney cysts too, need about an hour daily. But people do it 10 times and then stop. You must do it continuously. For example, Kapalbhati till 7003. Similarly, do not be careless with medicine intake. Doctors indicate the dose. 1 tablet, 2 tablets, once, twice, or thrice a day. You decide as per your nature. The doctor only guides you. Your own constitution is the real measure. For some medicines, we fix a set dose. For example, IU Prime is given on an empty stomach. When the body is very weak and not responding, when other medicines are not working, to lift the body, we give IU Prime, Swan Bhasma, Hirak Bhasma and Moti Pishti in combination. Very powerful. These are top-level medicines taken regularly. Those with serious illnesses may take such therapies for 1 week to 1 or 2 months. Jal Neti, Sutra Neti, Nasya, Kunjal, these cleansing practices should be done weekly. Some things must be done at least once a week. Nasya, Vaman, Neti, a little steam, and a self-massage with your hands. There is no difficulty in this. Weekly care is important. Those who cannot take medicines daily can at least support themselves weekly with vitamin D, B complex, and key nutrients. Lack of B12 and B vitamins causes neuropathy, poor blood circulation, and many subtle issues. Weak life force, or ojas, is also a cause. Instead of synthetic, chemical, animal-based multivitamins, we suggest natural options like daily energy and daily active for B complex and 42 nutrients. Those with iron deficiency need iron support. Those with low calcium need calcium support. Vitamin D must often be taken in higher doses, and B12 as well. Daily energy and daily active are for deep deficiencies and ongoing health issues from lack of nutrients, under the name Nutrella. There are many supports. For example, for arthritis, after Panchakarma and medicines, when joint pain is relieved, we use Nutrella Orthocare to refill the body with micronutrients. Deficiencies, not just arthritis, cause depression, postural changes, joint stiffness, and many other problems. Then the spine's 33 vertebrae. All joints, bones, muscles, nerves, and tissues start becoming deformed. To avoid such degeneration, we must prevent malnutrition, especially in diseases like arthritis and diabetes. In arthritis, there are strong diet restrictions. You cannot eat sour, cold, or heavy foods. So many protein-rich foods are limited. Cold foods are avoided, sour foods are avoided, and heavy foods are avoided. So protein drops. Pulses, soy, paneer, and other protein sources become difficult to eat. Milk, curd, buttermilk also reduce, so strength goes down. Vitamin C, which repairs cells, also becomes low. So many kinds of damage happen in arthritis. That is why we give Nutrella Orthocare. You have to stop many kinds of fruits. Many dry fruits too, like dates and raisins. People give just 1 or 2 pieces, not more than that. So diabetes care and ortho care become very important. Those who have many diseases together often suffer from deep malnutrition. For them, men's care, women's care, and kids' care are useful. Nowadays, even children don't get all nutrients from normal food.